choosing the best qualified laser staff they can, number one. And number two, they have to be compliant or follow the instructions following the laser treatment as far as returning for post-operative visits, for taking their drops, taking their ointment, etc. Well, those are voluntary things. But ultimately, everyone has different healing abilities. 98% of people will heal in a certain predictable manner. And the laser treatment, the laser itself, the computer itself, takes into account that the patient's going to heal in this predictable manner. And that's why we get 98% patients who get 20/20 vision. There is some, people heal differently. Some people will heal a little bit different than the average. And that's why some people wind up with less than 20/20 vision, maybe 20/25, 20/30, 20/40. So ultimately, it's the patient's healing ability which will really determine how well they will see from the surgery.
Why do your patients...
Stop, right? Stop?
No, it's okay.
Okay, okay. Yeah.
What are some of the motivations for people, your patients? You've treated a lot of patients over the years.
Right.
Thousands, right?
Thousands, yeah.
What
Yeah, I've treated thousands of patients over the years, yes. Mm-hmm.
What were some of the motivations for them to have PRK?
What motivates people to have PRK has changed. During the clinical trials, the motivation was more professional. We had a lot of people who required good vision because of their job, for example, that firemen, policemen, people who played golf professionally, for example. These are the people who sought out the procedure early. Now people having it done basically as a cosmetic procedure. They don't want to bother with contact lenses or glasses anymore. One of the big motivating factors today is the fact that people have been who have in the past worn contact lenses very well, as they get older, their eyes tend to dry out more, and they really can't tolerate the lenses as well. And therefore, they're looking for an alternative to contact lenses. And the alternative is PRK.
Can people play sports with after laser surgery? I mean, is that a motivation?
I have an awful lot of people who will have it done because they're golfers. They want to see the golf ball. They say, I want to see that ball when I hit it 250 yards out. I want to see where it lands so I can find it, you know. I say, hit it right in the fairway. This way you can find it more easily. Just ride up to the fairway and there it is, you know. Don't hit it in the rough. But we have an awful lot of golfers who have it done.
Actually, you've had a very famous golfer who's had it done. He's a golf pro?
Yeah, he's a golf pro. He was a #1 teacher of the year in 1997. Yeah.
You've had a lot of famous people who have had PRK. Would you?
Well, a lot of people don't want to be identified. You know, we've had doctors, of course, doctors' families. We've had sports people. We've had newscasters themselves. About a year into the study we was approached by Dr. Max Gomez, who's obviously a medical reporter in the New York metropolitan area on TV, and we were able to, he asked me to do a surgery after he did his research as to try to find the best center to have it done. And so he had very successful surgery done with us. We also were able to treat his wife and various relatives too. What?
Okay, you're ready to go.
Okay.
Dr. Dello Russo, you've performed eczema laser correction live.
I'm sorry. Stop. Sorry, there's something else here. I don't know what's going on.